Oh, okay. I'm going to start with the test that will be used to compare function of the cranial nerves. The first cranial nerve will be the patient's sense of smell. The second will be the use of the Snellen chart. If needed, that's what I would use in order uh, to figure the sense of sight. 3, 4, and 6 will be the cardinal gaze test. 5 will be the smile test. 7 will be puffing up the patient's cheeks. 8 will be the patient's sense of hearing, or his lack of, and the Weber and Ryan test. 9 will be the having my patient say ah. 10 is the rise and fall of the soft palate, and 12 will be the patient sticking his tongue out. So to begin my assessment, I will first wash my hands, check the patient records just to get any precautions or any information I would need prior to the assessment. I would then step into my patient's room, or I would have my patient step over. Now first I ask him to give me his name, first and last, and birthday.
Delangio Welch, August 31st, 1989.
Okay, so I would then verify if he's who he is. He would be who he is after verification, and then I would pull the curtain and provide privacy for the patient. I would then begin the assessment by asking questions, and I'll start with the patient's head as the beginning of my assessment. I'd ask him, do you have any headaches, any issues, any head trauma, any head damage, anything that I should know about your head before I begin?
No, not at all.
Assessment. Okay, no problems with head. So I would then first week after the interview, I would begin, or after getting information verbally, subjective information from him, I would begin with palpation of the scalp. Or no, I would first begin with a visual view of the patient's scalp. I mean, keep your glasses on for now. I would check for symmetry on both sides of the head. I would take a look behind ears. I would look for any issues with the scalp, any issues with skin on the head. And from my inspection, the patient seems pretty well. I would check behind both ears, the neck area, head. I would take a look at hair. Just looking for anything that would be abnormal, any lesions, scars, scratches, anything that I would need to know. I would next palpate the scalp and ask about any pain as I palpate. You feeling anything?
No.
Any issues?
Nope.
Okay, nothing there. I would note any lumps, bumps, or bruises that I would feel as I'm feeling. None there. I would then move directly into my neck assessment. And with the neck assessment, I ask them about any issues with range of motion, moving your head left to right, any neck injuries there.
No, not at all.
That's right. Now I would ask other subjective questions moving directly into a neck assessment. And I would begin first with the lymph nodes. And I would start with the preauricular in front of the ears, postauricular behind, occipital, the superficial cervical on the neck, the deep cervical behind the superficial, the posterior lymph nodes, posterior cervical lymph nodes, the subclavian lymph nodes right along the superior clavian lymph nodes, the lymph nodes on top of the clavicles, the submental here just below the mandible, the mandibular along the mandible line right behind, and the tonsillar directly underneath. I would then have my patient open his mouth, just say ah for me real good, and that would be me checking his TMJ joint, and I can feel that. You can close enough. And I would then step behind the patient. I would step forward a little, and I would step behind him and palpate the neck, and then I would have him swallow so as to find the thyroid. All right. And I would also note that the trachea seems to also be symmetric or aligned perfectly. Could you swallow one more time for me? So that'd be the completion of the neck assessment. I will move directly into an eye assessment. Now I would ask him, I see he's wearing glasses. I'd ask him, how long have you been wearing glasses?
About 4 to 5 years now.
4 to 5. Any headaches when you're not wearing them?
No, not at all.
Okay, and you wear them pretty regularly?
Yeah, every day.
I would continue asking other questions regarding his eyesight, and I would move directly into looking visual inspection of the eyes, checking the conjunctiva on the top and bottom on both eyes. And they both seem to be pink and moist. I would check the sclera, and they seem clear and white now. Then you just been up for a little bit. Looking at the cornea and the pupils, making sure that the pupils seem to be the same size, and they both seem to be the same size there. I would then begin an accommodation assessment, which I'll have you take a look at just the point, just anywhere out there. Just take a look, keep looking, then focus on the pen, and then look out one more time. All right, and then look at the pen, and then one more time all the way up. Just keep looking, and then look at the pen. And that would be me checking for accommodation. I would then take a look at how his eyes react to light, and I would bring light from the side and look for the pupils to dilate, which they do. I would then check for the right eye to also accommodate to the light from shining into the left eye. And accommodation is in both eyes there. I would check the opposite eye for that. I'm gonna step over. And still, and that eye works. I would then check the second eye there, or the right eye. And they both accommodate to light shining. I would then check the 6 cardinal gazes, and I just want you to follow the pen, follow it up, and down, back, across, up, and then back again. And there I would note that there was no lag in eye movement or anything of that nature. I would then check the outside eye structures, the eyelids, the eyelashes and eyebrows. The hair on the eyelashes and eyebrows seems to be clear of debris, no like missing patches or chunks. And could you close your eyelids for me? All right. Then open them for me. Then the eyelids seem to function perfectly, no abnormal behavior of the eyelids. I would then go in for the nose inspection, in which I would ask questions about the patient's nose. Have you ever broken your nose?
No, I never broken my nose.
While also palpating the nose, any issues with your nose, any sinus issues?
No, never had, no.
As the answers, I would also check the sinuses there, also here and there. No pain when I press there?
No.
No pain? All right, great. I would then move into taking a look into the nose. And from there, I would note that the nostrils seem to be no blockage, no deviated septums. I would then check for proliferation of the septum. And that seems to be aligned perfectly there. Any issues with your sense of smell?
No.
You're smelling perfectly?
Yeah.
No problem there. I would then move into an ear assessment, and turn this way for me. And taking a look at the ears, I will first start with a visual assessment and ask also about his hearing. Have any issues hearing? Any issue hearing lower sounds, higher sounds?
No, I hear fine.
Okay, great. I would then start by pulling on the pinna, pushing on the tinus, and checking the mastoid process by pushing, pulling, and pushing. Any pain there?
Nope.
No pain there. And I would repeat that on the other side there by pushing, pulling, and pressing there. Any issues there? No pain?
Nope.
Okay, perfect, great. I would then take a look inside of the ears. And there seems to be, I would pull up and pull back on the ears, noting that there is no dryness, doesn't seem to be any rash, a bit of cerumen, but nothing to be alarmed about. Have them turn this way for me. And I would repeat the process on the other side, which I would pull up and pull back. And I would note the same in this here, nothing abnormal, nothing to worry about. I would check the backs of the ears and along the bridge, and everything seems fine there. After checking the ears, I will move into the final part of my assessment, which would be the mouth. I would assess the lips and also ask the patient any issues with chewing, any teeth issues, dentures. I might ask about swallowing or moistness of the mouth.
No. Nope, not at all.
Yeah, great. I would assess the lips, just seeing they seem not dry. They seem symmetrical. Would you smile for me? Smile, and the smile seems to be aligned. Well, could you just say ah for me over your mouth?
Ah.
I would note, as I'm checking the mouth, I would take a look at the structure of the mouth, making up the lips, the teeth, the gums, the uvula, tonsils, soft and hard palate, the buccal mucosa, the tongue, I think I said that though, and the pharyngeal wall, and teeth. I think I hit everything. Pretty sure I did. So I have them say ah for me again. Big and bright. Stick your tongue out for me. All right. Could you like push your tongue down as far as you can? But open your lips up. I need you to there you go. I will note that the pharyngeal wall and the entire mouth itself seems moist, no dryness. Push your tongue down. You're making this so hard. I will note that the uvula is aligned, centered in the throat. And I would also note that I can't see your tonsils. I need you to. Do you have tonsils?
Yeah.
All right. Let me. It would be useful to use a tongue depressor that I don't have. Just bigger. And I would note that the tonsils seem to be at a +1, meaning that they're furthest apart. With that being said, I would then, I think I'm complete. That would be the complete of my assessment. I would then follow with my patient, make sure everything's fine with him, ask him any other questions that I would need to know. I would exit the patient's room, wash hands, and that will be the complete, or begin my charting. And that is the end of my head, neck, ears, eyes, nose, and mouth assessment. Thank you.